Reminder that COVID-19 does not discriminate. El Paso infectious disease expert Dr. Ogashika Alozi tested positive for coronavirus.
We've spoken with him dozens of times about the impact of the virus in the borderland, the virus that is now impacting him. And Dr. Alozi now joins us live to talk about his experience. Hello, doctor. How are you feeling?
I feel better today. I mean, it's one of those things that people that have had this virus know it's day to day. I mean, I've returned to work. I feel kind of blessed that I am not somebody that had the severe side effects and symptoms of COVID-19. And I mean, that's all I can do is say day to day.
How'd you get it?
So, I mean, my wife's a family medicine practitioner at Texas Tech. She has front care, sort of healthcare worker, sees patients. I mean, and so we think potentially I may have gotten it from her. But at the end of the day, you don't really know, right? I mean, all the people around me that I interact with on a daily basis have been tested over the last 2 weeks and everybody's negative. So I just don't know. I think one of the important things for me is that I'm blessed and I'm thankful that I'm here. I'm thankful that I didn't have the severe side effects. I'm blessed that we're in a community that had the convention center available. So I was able to get the monoclonal antibody. And I think that probably helped me. It gave me a terrible headache, actually. But I'm hoping that I don't have the sort of long-term sort of COVID long haul syndrome that they talked about on 60 Minutes the other day.
And Dr. Alozi, you were expecting to get vaccinated, of course, due to your profession. This is a situation that many people may be encountering now in the coming weeks and months as the vaccine becomes more readily available. What happens if you are about to get vaccinated, you're scheduled to get vaccinated, but then you test positive? What happens next for you?
Yeah, so in a crazy irony, I guess, my wife was supposed to be vaccinated 24 hours later. After she found out I was going to be vaccinated 48 hours later. And so it's kind of crazy in that sense. Sort of circling back to your question, I think it's important for people to understand that what the CDC and the science recommends is if you've gotten a natural infection, you probably have antibodies for up to 90 days. You can make a decision to defer to 90 days. But if you get the vaccine earlier, that's fine as well. And so I have every expectation in the next few weeks when it's available to me through some means to get the vaccine, to get both doses of it. And then I have a sort of aging parent that's in Nigeria. And so I hope to go see her after I get my 2 vaccines later in the spring. But absolutely, our community should not take this as a reason not to get vaccine. If you've been infected in the past, please get your vaccine because this gives you that extra protection. And if you haven't been infected, even more reason. If you're above 75, if you're a healthcare worker, an essential worker, we really need to get our kids back to school. And so it's critically important that those teachers get this vaccine.
Now, you may recall, Dr. Alozi, that we did an extra where we had my son who had contracted COVID-19. And one of the questions that I had asked him and that I'll pose to you, any fear of transmitting it to others, family, coworkers, and whatnot?
So I guess when I initially found out back on the 18th or so, yeah, I was worried. I mean, I was scared. And I was worried that I'd potentially given it to my children. I have a 14-year-old daughter, 10-year-old son. They've never had any symptoms. They've been tested, thankfully, and they've been both negative. And so I think I did what I was supposed to do. I removed myself from a work environment, removed myself from the rest of my family that could potentially be exposed, and was really kind of quarantined at home. But and so one of the things I've sort of learned, and I've been talking about this for a while, is that kids don't get as sick with this as adults. Kids aren't a transmission agent like other adults are. And if there's anything that we can come together on, I think it's critically important that as we go into 2021 with vaccines on the horizon for the rest of the community, we really need to get our kids back to school. We've probably had a generational transfer of education and wealth by the lack of kids going to school, and this community needs them back in school.
All right, Dr. Ogashika Alozi, thank you so much for taking time to talk to us and sharing your experience and the fact that you now have COVID-19. Thank you so much.
Get well, Dr. Alozi.
Thanks, guys.